Hello, welcome to the EMS Incident Command Channel. The channel where we will share information to help you grow your leadership potential, improve in your promotional exams, and build your personal development. We will continue to talk about the importance of EMS and the things that we do every day. So, today we will talk about the secondary assessment. We recently discussed the primary assessment and its importance in one of our previous videos. We will connect the link at the end if you haven't seen it. Now, let us grab our detective hats and investigate the importance of a secondary assessment. In the field of healthcare, patient assessment forms the bedrock upon which accurate diagnoses and appropriate treatment plans are built. While primary assessment is commonly regarded as the initial evaluation of a patient's condition, secondary assessment plays an equally critical role in providing comprehensive and thorough healthcare. This video aims to delve into the reasons why conducting a secondary assessment is of paramount importance of unveiling hidden injuries, enhancing diagnostic accuracy, identifying coexisting injuries, monitoring and managing outcomes, facilitating effective communication with medical control and through our documentation for the overall improvement of patient outcomes. One of the primary objectives of secondary assessment is to uncover injuries or conditions that may have been overlooked during the primary assessment. While the primary assessment primarily focuses on identifying and addressing life-threatening emergencies, the secondary assessment provides an opportunity to explore less obvious signs and symptoms that may indicate underlying problems. This in-depth evaluation is particularly crucial when dealing with patients who have multiple injuries or complex medical histories. Gaining a detailed understanding of the mechanism of injury is also crucial in the field assessment. The mechanism of injury or nature of illness provide valuable insights into potential injuries or conditions that may require immediate attention, such as spinal precautions or early intervention for internal bleeding. Second, we will discuss enhancing diagnostic accuracy. Accurate diagnosis forms the cornerstone of effective medical treatment. The secondary assessment aids in refining and validating initial findings, thereby improving diagnostic accuracy. We reassess initial findings and identify inconsistencies or contradictory symptoms. In the field, paramedics perform a focused physical examination tailored to the patient's chief complaint or injury. Paramedics should gather information regarding the forces involved, the nature of the incident, and any relevant contextual details. This examination includes assessing vital signs to include blood pressure, heart rate, lung sounds, pupils, and neurological status. The initial vital sign is the most important and should be done manually. Any sudden rise or fall can help us pivot our treatment as needed. When checking the heart rate, we must identify any irregularities, its strength, and the rate. Whether we listen to the heart rate or check it at the wrist, we should document what we find so we could note and record if any sudden changes happen during our EMS care. When we listen to lung sounds, we note the rate, any sounds or lack of sounds, and the depth of breathing effort. Is the patient using accessory muscles? This is the importance of modestly exposing the patient. We must also examine the patient's pupils. We need to know if they are equal or unequal, small or large, and how they react. These little things can help us see into our patient's condition without needing to be invasive. This evaluation can be done while talking to the patient so we can determine their neurological status. This is something that needs to be done with every patient and truly takes no time but helps us examine the issue the patient is having. This process allows for a more precise diagnosis, reducing the risk of misdiagnosis or delayed treatment. Furthermore, a comprehensive secondary assessment enables healthcare professionals to differentiate between primary and secondary conditions, leading to appropriate treatment interventions and improved patient outcomes. The sample history is a concise assessment tool used by paramedics to gather essential information about the patient's condition. It stands for signs and symptoms, allergies, medications, past medical history, last oral intake, and events leading up to the present condition. The sample history aids in decision-making, guides treatment choices, and ensures effective communication with hospital staff upon arrival at the ER. Third is pain management. Assessing pain is crucial in managing patient discomfort and guiding appropriate pain management interventions. Paramedics should evaluate the location, intensity, quality, and characteristics of pain reported by the patient. For this, we use the OPQRST acronym. Utilizing a pain scale, such as the numerical rating scale or visual analog scale, allows for consistent documentation of pain levels and aids in assessing the effectiveness of pain management interventions. Addressing pain not only improves patient comfort but also helps alleviate anxiety and stress during transportation to the hospital. Always remember to follow your local or region standing medical orders for pain management. We need to be sure to be cognitive in identifying coexisting injuries and comorbidities. In many cases, patients may present with multiple injuries or pre-existing medical conditions that can complicate the diagnostic process. The secondary assessment allows healthcare professionals to identify and evaluate these coexisting injuries or comorbidities. By considering the interplay between various medical factors, EMS can develop a more comprehensive understanding of the patient's overall health status. This holistic approach facilitates the development of personalized treatment plans that address all relevant health issues, thereby optimizing patient care. Fourth, we must continue to monitor and manage all ongoing conditions on all calls. In certain medical scenarios, primary assessment may not adequately capture the full extent of a patient's condition. For instance, some injuries or medical conditions may not manifest immediate symptoms but may require continuous monitoring and management. We call this the ongoing assessment and includes full sets of vital signs every 5 or 15 minutes, depending on patient needs or after interventions. Through the secondary assessment, healthcare providers can assess the progression of ongoing conditions, evaluate treatment effectiveness, and identify potential complications. Here, what looks like an initial bloody nose was a child who fell off the swings and injured his head. Paramedics should closely monitor vital signs and mental status. Ongoing monitoring helps paramedics make informed decisions, adapt treatment plans, and ensure patient stability during transport. Our final point is facilitating effective communication and collaboration with the staff at the hospital and family at the scene. By sharing the findings of the secondary assessment, healthcare professionals can integrate more effectively, allowing for a holistic understanding of the patient's condition. This collaborative approach promotes interdisciplinary communication, facilitating the exchange of valuable insights and perspectives. Such teamwork is essential in complex cases, as it enhances the accuracy of diagnosis, reduces medical errors, and fosters patient-centered care. Secondary assessment plays a pivotal role in paramedic care in the field and through documentation, despite the limitations imposed by the pre-hospital setting. Documenting any change of treatment or improvement in patient's condition helps with the continuity of care. By conducting a focused physical examination, understanding the mechanism of injury, obtaining a comprehensive sample history, assessing pain, and continuously monitoring vital signs. Healthcare professionals must recognize the vital importance of conducting thorough secondary assessments to ensure accurate diagnoses, tailored treatment plans, and the overall well-being of their patients when discharged. Is there a topic you would like us to cover? Let us know in the comments. Please like and subscribe. Don't forget to hit the notification bell for more EMS educational videos. Until next time, see you out there.